Hello YouTubers! Thank you so much for clicking on this video. I hope you are well today and in high spirits. I experienced some major PMS signs and symptoms that were so convincing for the last 9 days that had me thinking and pondering to myself that if I happen to miss my period in a few days, I'm definitely going to have to take a pregnancy test. Long story short, my period has come. Yay! But it got me thinking. Those symptoms felt so much like pregnancy that for the last 4 days before my period actually started, I kept thinking, oh man, what if I could actually be pregnant? Especially with the amount of women recently wishing me to get cryptically pregnant. So many women have been wishing a cryptic pregnancy on me. And it is possible for me to get pregnant, of course, because hubby and I use the pull-out method as birth control in combination with breastfeeding. Neither of us have any issues getting pregnant, so I was anxious that the pregnancy wishes from other women could have an effect. I know it sounds funny now. It was paranoid thinking, but words are very, very powerful. Words are very powerful. Anyways, once my period started 4 days ago, the pregnancy thoughts quickly left my mind because, of course, my period came, so I can't be pregnant. But what if I was late or only spotted for like a day? What if my period wasn't my normal period? How would I have felt then? So I decided a video covering these specific 3 subjects would be quite helpful to all women. I have gracefully included the signs and symptoms of phantom pregnancy, PMS, and extended gestational cryptic pregnancy side by side for us to compare and contrast. When you look at these conditions realistically, it becomes quite clear on how alike they truly are. So let's go ahead and compare some of the signs and symptoms of phantom pregnancy, PMS, and extended gestational cryptic pregnancy. Some of the signs and symptoms of a phantom pregnancy are cessation or continuation of the menstrual cycle, heavy cramping or even clotting periods, as well as just spotting is normal. In extended gestational cryptic pregnancy, it is exactly the same. You have a cessation or continuation of menstruation, heavy cramping, or even clotting periods, as well as just spotting is normal. And then let's look at PMS, which is here in the middle. You can have spotting and cramping during PMS before you actually start your period. So then let's look here at phantom pregnancy. It says symptoms may come and go. You may not feel pregnant all or most of the time, likely during your period. And in extended gestational cryptic pregnancy, it is said that symptoms may come and go. You may not feel pregnant all of the time, most likely during your period. And now let's look at PMS. Symptoms may come and go. You may not feel PMS every month or every day. So with all 3 conditions, you can experience the standard pregnancy symptoms such as mood swings, sore, tender, or enlarged breasts, painful nipples, nausea, increased sense of smell, food aversion, fatigue, heartburn, bleeding gums, indigestion, constipation, metallic taste in mouth, bloating, water retention, gas, backache, increased urination, skin changes, water retention, sleep disturbance, leg cramps, backache, and many other common standard pregnancy symptoms. You can experience these in all 3 conditions. They are exactly the same. In both a phantom pregnancy and an extended gestational pregnancy, you can experience loss of pieces of what is interpreted as a mucus plug and the sensation of fetal movements that respond to sound, light, and sugary foods. This can be experienced in both conditions. The experience of abdominal cramping, round ligament pain, weight gain, a distended abdomen, signs of preeclampsia, signs or even contractions can happen in both a phantom pregnancy and an extended gestational pregnancy. I do want to point out here that in PMS, you can experience contraction-like cramping and tension in the pelvic region. The slowing down of the digestive tract due to increased levels of progesterone can cause more cramping and discomfort. When a woman is trying to conceive, it is during this time that women report that they feel the most phantom kicks and phantom flutters, even though they know baby would be too small to feel, only being days past ovulation and most likely not even implanted. When women are trying to conceive and they experience PMS symptoms, they can experience the slowing down of their digestive tract, which can cause cramping and discomfort within their intestines, making it more likely that they are feeling the movement of fluid and air and fecal matter because of the slowing down of the digestive tract. So it's during this time that a lot of women who are trying to conceive will report that they feel phantom kicks and phantom flutters, even though they know that if they are pregnant, the baby is too small for them to feel it, but they still feel it regardless. I just want to point this out because it happens in all three conditions. It happens in phantom pregnancy, PMS, and extended gestational pregnancy. So let's compare more signs and symptoms between a phantom pregnancy, and an extended gestational pregnancy. It says labor signs can go on and off for weeks or even months. And in an extended gestational pregnancy, it says labor signs can go on and off for weeks or even months. Both of these are exactly the same. So in a phantom pregnancy, it can be a gestation period of however long the woman themselves decides. They can go for 9 months, up to 7 years, or longer if she decides. And she can change the due date several times. In an extended gestational pregnancy, it is said that there's a gestation period of 22 months or longer. So another way of wording it is that the gestation period is decided by the woman and the due date can be extended when the woman feels it is necessary. So in the extended gestational cryptic pregnancy community, it is completely acceptable for a woman to say she's in active labor for days, weeks, or months, not produce any baby, and say that she is no longer in labor but went back into pregnancy, and that now her due date is several months to several years from that time. And that's completely acceptable. So it's exactly the same in both a phantom pregnancy and an extended gestational pregnancy. And both report slow growth of the abdomen. So now I just want to quickly cover the causes of phantom pregnancy, and the causes of extended gestational cryptic pregnancy are exactly the same verbatim. Exactly the same verbatim. So I'm just going to cover one of them and just cover both subjects in one speech. On the causes of both phantom pregnancy and extended gestational cryptic pregnancy, as taken from several sources and websites, is hormone imbalance caused by one or a combination of factors such as nutritional deficiencies, PCOS, menopause, postpartum less than 1 year, breastfeeding, low body fat, or on birth control. The causes of both phantom and an extended gestational cryptic pregnancy include victim of domestic violence, sexual abuse, verbal abuse, or incest, longing for pregnancy, multiple miscarriages, or a loss of a child or spouse, psychological disorders such as bipolar, OCD, schizophrenia, and eating disorder, fear of pregnancy. A fear of pregnancy can happen in both a phantom pregnancy and an extended gestational cryptic pregnancy. Depression, anxiety are both causes. Extreme hardship, stress, or infertility can be the cause of a phantom pregnancy and the cause of an extended gestational cryptic pregnancy. And then let's quickly cover PMS. Causes of PMS are due to one or the combination of the following factors, which are pretty much verbatim of both the phantom and the cryptic pregnancy causes, which is hormone fluctuation, nutrient deficiencies, hormone imbalance, depression, anxiety, breastfeeding, low body fat, birth control, victim of domestic violence, sexual abuse, verbal abuse, or incest, extreme hardship, stress, or infertility can cause PMS symptoms. So now I want to quickly cover the confirmation of both or three of the of all three of these conditions, which is phantom pregnancy, PMS, and extended gestational cryptic pregnancy. First, let's just quickly cover PMS. Confirmation and treatment. Usually it's self-diagnosable and self-treatable with at-home remedies. Symptoms normally subside or disappear completely a few days into or after the start of menstruation. You can experience, or when you do experience, signs and symptoms of PMS, they can exacerbate your phantom pregnancy signs and symptoms or your extended gestational cryptic pregnancy signs and symptoms. And that's just something I wanted to note, that if you are experiencing PMS, they can exacerbate both of these conditions. So now let's quickly cover the confirmation of both phantom pregnancy and an extended gestational cryptic pregnancy. Because the confirmation of an extended gestational cryptic pregnancy is based off of symptomatic and subjective signs and symptoms, I can only list here the objective signs and symptoms that are the way of confirming an extended gestational cryptic pregnancy. And they are exactly the same for a phantom pregnancy. So I'm just going to cover both of them because they're exactly the same verbatim. The confirmation of a phantom pregnancy and the confirmation of an extended gestational cryptic pregnancy are a pelvic and abdominal exam lacking a growing uterus and fundus, physician unable to palpate fetal parts upon physical examination, negative ultrasound, heartbeat unable to be confirmed by a healthcare professional, a negative blood test, and a negative or slight positive urine test. And this can happen in both a phantom and an extended gestational cryptic pregnancy. Now, it is completely acceptable in the extended gestational cryptic pregnancy community to still be pregnant with a negative blood test, a negative ultrasound, a negative urine test, a heartbeat unable to be confirmed by a healthcare professional, physician unable to palpate fetal body parts upon physical examination. And it's completely acceptable to still be considered pregnant even though your pelvic or abdominal exam is lacking a growing uterus and a growing fundus with a palpable baby inside. These are exactly the same list that they go through when they are confirming and diagnosing a phantom pregnancy in the medical community. So now let's quickly cover the difference between treatment in a phantom pregnancy and treatment for an extended gestational cryptic pregnancy. If the woman is willing and ready to actually get some medical professional help, the treatment of a phantom pregnancy is complicated, but it is something that is easily done if the woman is willing and ready to go through the treatment. So the treatment for a phantom pregnancy, first of all, it is important to confirm that there really is no baby present in the mother's uterus. That's first and foremost the most important thing. This is of the utmost importance and not taken lightly. Ruling out a fetus in phantom pregnancy is taken very seriously in the medical profession. As it happened so often in the past, doctors had to be thoroughly trained in positive signs of pregnancy. Pregnancy testing and blood and urine, as well as a pelvic abdominal physical examination and negative ultrasound, will confirm this. However, there have been cases where women have tested positive in urine for pregnancy, despite the fact that they are not actually pregnant. When no baby is seen on ultrasound, there is an absence of heartbeat and no delivery occurs, then it is fair to say that the woman is not actually pregnant. Although phantom pregnancy may have been suspected during previous visits, it is not until these factors are clear that the official diagnosis of pseudocyesis is given with concern for the woman's overall well-being as a whole. It is routine management and a part of routine protocol in the case of pseudocyesis or phantom pregnancy to order an ultrasound of the uterus so the woman can see for herself that no baby is present. Doing pregnancy tests on urine and blood do not provide the same level of confirmation, as some women can interpret the findings as simply incorrect, as well as palpation of the uterus and fundus. Ultrasound findings are the ultimate confirmation of pregnancy or lack of conception. For women who are convinced they are pregnant but are actually not pregnant, being informed of this can be devastating. From a professional standpoint, it is best not to tell the woman that she is not pregnant. but in fact, it is much more therapeutic to just relay the lab findings and the diagnostic testing to her and hopefully let her gradually come to the correct conclusion by herself in her own time. Sensitivity and understanding is very important, and counseling is often necessary. Family, as well as a great deal of professional support, is vital for recovery. For women who are very keen to conceive, fertility support may also be necessary to make that a possibility. It is okay to have thought you were pregnant. It does not matter for how long. So now let's cover what the treatment is for an extended gestational cryptic pregnancy. And this is what's recommended by the cryptic pregnancy community. You are told to commit to a 2 to 5 year pregnancy that may even continue for several years past that time. Some even say it could last 7 years. You are told you will experience painful, agonizing, and even terribly concerning symptoms for months and even years. And you are told to believe that it's just prodromal labor and it's a result of cryptic pregnancy. In the cryptic pregnancy community, the treatment is, they tell you that you will have no help if any pregnancy complications should develop. You won't have any help for this secret pregnancy. In the cryptic pregnancy community, they say to wait for delivery of an unconfirmed baby for an undetermined amount of time and experience an unconfirmed, highly complicated pregnancy for well past 40 weeks. This is normal. They say that this is something that they recommend you do, is just wait. Just wait. They tell you in the cryptic pregnancy community to plan on delivering at home without any help because doctors won't believe you or help you. At least not the help these particular women are looking for. The doctor either plays along with the idea of a cryptic pregnancy or they become the enemy. In the cryptic pregnancy community, you are told not to push the issue of pregnancy with your doctor, as they will try to intervene and make you seek help from mental health professionals. It also says on several cryptic pregnancy websites that women have been given interventions by their obstetricians and psychiatrists. To the deluded cryptic pregnancy community, this psychiatric help is enemy number one. The women in the cryptic pregnancy community say that doctors will not help them no matter how much they ask. But when the doctors actually try to give them real help, these women refuse the professional help and insist on believing, feeling, and intuiting a cryptic baby instead. The very word cryptic means mysterious, obscure, puzzling, ambiguous. Nothing about an extended gestational cryptic pregnancy is actually mysterious, except not being able to palpate a baby during physical examination or not being able to find a baby in ultrasound, which sounds exactly like a phantom pregnancy, verbatim. Advising and acting as if a pregnancy this different, potentially dangerous, and never studied as a normal variation is critical. Why would you want to promote such an unhealthy and dangerous pregnancy as normal? Nothing about an extended gestational cryptic pregnancy is healthy, and the advice given by the deluded cryptic pregnancy community does not support the well-being of women in either situation, whether it be cryptic pregnancy, normal pregnancy, or no pregnancy at all. Why would you want to advise a woman not to see a doctor when their situation is much more complicated and concerning than most pregnancies and potentially dangerous for both mother and baby or babies? Getting these pregnancies confirmed and recognized should be top priority for these women in this community. The only way to do that is to go to the medical community and have the guts to speak up. Why would you want to put fear into other women, to teenagers, and even mentally disabled, and make them believe that if they are experiencing a pregnancy such as this, they will not be believed, labeled as mentally unstable and institutionalized? If this condition was real and is real, and an extended gestational pregnancy past the rare 12 months was possible, the few women who run the support groups and websites are doing a great job at monopolizing the production and distribution of misleading information, vocalization, resource exchange, and social networking. They make sure this condition gets very little attention from the medical or scientific community, as they see these important resources as the enemy. The women of this community begin to see and view the medical and scientific tests and clinical positive signs of pregnancy as the opposite of what they really are. Instead of there to help the women confirm the pregnancy and get the prenatal care they deserve, they begin to see this field and these positive signs of pregnancy as a way to prove them wrong, or as a way to get, or that the medical field is out to get them, or even that the doctor doesn't want to admit that he or she was wrong, which is a delusion in itself. So I hope this video helps someone determine for themselves how easily confused PMS and pregnancy symptoms are. They are exactly the same, exactly. You can experience PMS symptoms for 14 full days before the start of your period. These symptoms can feel and act exactly like pregnancy, but the start of your period lets you know that you're not actually pregnant. If you are still unsure, a negative pregnancy test or a negative blood test will confirm this. Just to conclude, and this is very important, doctors want to help you confirm your pregnancy if you are in fact pregnant. To every woman out there, doctors want to help you confirm your pregnancy. They want to do that. They also want to help you if you are experiencing a phantom pregnancy. If you are not actually pregnant, but you think you were or you thought you were, you can go to your doctor and you can ask for help. They are not going to treat you like a crazy person. They want to give you psychiatric help, and they will do that in a professional way. They're not going to treat you like you're crazy. Psychological therapy and psychotherapy are nothing to be ashamed of or embarrassed about. Everyone needs a little emotional support every once in a while, and you should not be ashamed for reaching out and getting that support you need. Being told you are not pregnant and instead experiencing very real feeling pregnancy symptoms with lack of a fetus is normal. So many women experience it, even if for just a few days. If they're actively trying to conceive, they may think for that full 2-week wait that they are pregnant and they're not, or they may even think for many weeks after that they're still pregnant, but they're not. There's so many different stories of women experiencing phantom pregnancy symptoms, actual pregnancy symptoms, and not actually being pregnant. And that's nothing to be ashamed of or embarrassed about. Phantom pregnancy occurs more often than you think. It definitely happens way more often than most women would like to admit. So I think it happens way more often than the statistics report, because I just think that a lot of women don't want to admit it because they're embarrassed when they really shouldn't be embarrassed. This is something that so many women experience, and especially when you're a teenager, when you first start becoming sexually active. So many of my friends obsessed about pregnancy symptoms when they weren't actually pregnant because they were just so concerned with not wanting to be pregnant. So they started manifesting symptoms of pregnancy when they weren't actually pregnant. They were scared they were pregnant. And that's very normal. If you believe you are experiencing an extended gestational cryptic pregnancy, I am not here to tell you that you are not pregnant. But I will tell you this. You are far more likely to be experiencing an extended gestational phantom pregnancy based upon how common phantom pregnancy actually is and has been and how often it's been experienced in the past. It is completely normal to ask for professional help. If you are experiencing constant adverse or negative symptoms, please seek the professional help you deserve. I advise for you to do some research for yourself on how you create your own reality. Thank you so much for watching. Remember, you are so strong, powerful, brave, fierce, and capable of anything you put your mind to. Sorry this video is so long. Thank you guys for sticking in there. So put your attention toward perfect health, happiness, family, friends, and love. Be well, be happy, but most important, always have fun, guys. Bye. Thank you.